everyone who is watching this live. I am Radia. I'm speaking on behalf of Probashi Medical Services. And today we have with us a very special guest, a very renowned doctor, and we'll talk to her. But before that, let me give you a little brief introduction on what we're going to talk about today. Parenthood is a very blessed experience for various couples around, and we tend to take it for granted like it's a natural process. It happens naturally and very easily. But for some individuals, it's a very big challenge. Hence, we have the medical marvel called IVF, in vitro fertilization, which has revolutionized our idea of reproduction and has made the dreams of various parents to become parents come true. So let's get started with our doctor. Hello, Dr. Prachi.
Hi, Ravya. And I'm sure the audience are all well in health. And it's a blessing to be a parent. I can say so, being a mother of 8-year-old. It's a wonderful experience, and of course, none of us should be devoid of such experience. So let's understand how can we achieve this dream of parenthood.
Yes. So let's first have a brief introduction about you, doctor. Let's hear a bit about yourself.
Yeah. So I'm Dr. Prachi Benara. I'm working with Birla Fertility and IVF. I'm heading their Gurgaon center. I have done my clinical training in fertility from Maulana Azad Medical College, India, and also from Oxford University, UK. I have then done a postgraduate diploma into reproductive and sexual health from University of South Wales, UK. And I've been practicing IVF in Birla Fertility and IVF since last 3 years.
Okay. All right, doctor. Can you tell us what is IVF for the novice people who do not know what IVF is?
So, IVF is a simple technique in which we help the egg and sperm to meet each other. So, in situations when the egg and the sperm are not able to meet inside the fallopian tube of a lady, the movement and the meeting of the two gametes are facilitated outside by doing a procedure called IVF. So, in layman language, IVF is doing the work of fallopian tubes inside the lab. So, it's like outsourcing the work which is done inside the fallopian tubes of a lady, that is, meeting of eggs and sperm, inside an IVF lab by creating an environment exactly similar to the fallopian tube environment inside the lady, and then producing an embryo and then transferring this embryo directly inside the womb of the lady. So, unfortunately, if I want to highlight, we are heading towards an epidemic of subfertility. WHO did a survey and found out that one out of every six couple in rural area and one out of every four couple in urban area face difficulty in achieving a pregnancy. So this is the statistics. This is shocking to know. And most of us try to hide behind ourselves, and we hesitate in taking help. We hesitate in taking and talking to our own colleagues, our family members, our friends, because we think that being not able to procreate, being not able to produce children, is a question on our womanhood or manhood. So, friends, I first want to highlight that we are perfect man and woman, but sometimes we need assistance in achieving a pregnancy. So, it's important to come up, ask for help, and IVF is a wonderful process by which the success rate almost touches 75 to 80%.
Thank you, doctor. Now, moving on to my next question, which is who can do IVF and Is there any age limitation to who are eligible for this process?
So, success rate of IVF is directly dependent on the couple's age and lady's egg reserve. So, of course, if your doctor has guided you for an IVF cycle, it is important to do it as early as possible. If we talk about what maximum age we can do an IVF up to is 50 years in case of female and 55 years in case of male. But it is very important to remember that as we age, the chances of success of IVF continuously decreases. And sometimes, if the woman or the man is beyond a certain age, then we might also have to use donor eggs to conceive a pregnancy, which none of us want. Obviously, all of us want genetically own child. So, if we've been advised in IVF, it is important to do it quickly to achieve a better success rate. Now, whom should be advised in IVF cycle? Um, if a lady has blocked fallopian tubes or the man has suboptimal semen parameters, a direct IVF cycle is advised. When I say suboptimal semen sample, it means that if the man's motile sperm count is less than 5 million, then directly an IVF cycle is advised to such a person. Now, in case everything is okay, if the semen analysis is fine, if fallopian tubes are fine, if the girl is ovulating, but unfortunately, then also if she is not able to conceive a pregnancy, which is called unexplained subfertility, then also after 2 years of trying, the doctor advises an IVF cycle because the success rate of IVF cycle is almost touching 75 to 80%.
All right. Now, what can you give a brief about the procedure that goes on to the IVF treatment, like step by step procedure?
Right. So, IVF involves a couple of procedures. The most important is pre-IVF counseling and preparation. So, we should be in best of our shape, we should be in best of our health to achieve a pregnancy. So, whenever we are planning an IVF cycle, it is mandatory to have a balanced diet, drink a lot of water, have a good night sound sleep of 8 hours. Try to remain a little stress free by either meditation or a simple walk in nature. If you are obese, then honest attempt to lose weight should be done before an IVF starts. So, IVF preparation is very important. Your doctor generally advises you certain antioxidant both for you and your partner. You are also advised vitamin D tablets and a folic acid tablet. Pre-preparation is generally carried on for a month or two. Also, it is important to undergo counseling session by the fertility center you are opting an IVF cycle because it's very important to understand the finances involved in the cycle and also find a correct answer to what is the expected success rate and how to cope up with positive and negative results. Officially, the IVF cycle starts from second day of the woman's period. From the second day, we start giving certain injections. These injections are hormonal injections, generally known as follicle stimulating hormone. These injections start from day 2 and continue for 10 to 11 days. When all the follicles inside the ovary of a woman, which is determined by doing an transvaginal ultrasound, when all these follicles are mature, then the lady is put to sleep, and by inserting a very, very thin, long needle inside the vagina, the eggs are retrieved out. Now, once we've got the eggs, we request the woman's partner to give his semen sample. After the semen sample is washed, The best quality sperms are separated from the semen sample by simple techniques like Pixie or microfluidics. And once we separate these good quality sperms, we combine them with the egg by a process called ICSI or IVF. And then this resultant embryo is grown inside the lab for 5 days to a stage called blastocyst. And then finally, it is put back to the wombs of the mother, which is known as embryo transfer. Now, embryo transfer can happen in two ways. One is called fresh embryo transfer, the other is called frozen embryo transfer. In case we transfer embryos on the day, on the cycle where we have retrieved the eggs, it is called fresh embryo transfer. And if we transfer the embryos in the next cycle, it's called frozen embryo transfer. And after embryo transfer, we do the urine pregnancy test after 14 days. And all of us are delighted to see two pink lines in the pregnancy test.
That's the blessing. That's
Yeah,
what they're looking for. Yes.
absolutely.
Like you were saying, that the fresh method of doing IVF, like immediately after it's been matured and fertilized, you put it inside the woman's womb. Is there a timing criteria, like in the cycle of the woman, when you should insert the eggs inside?
Yes. So when we're doing a fresh embryo transfer, after the egg retrieval, 5 days we give the lady certain progesterone hormonal supplements in the form of injections and gel. And on the sixth day, we do the embryo transfer, which is known as day 5 or blastocyst fresh embryo transfer. In case we are planning a frozen embryo transfer, that is done in the next cycle, roughly around day 15th to 20th of the woman's period.
How many days can you keep an egg frozen?
Okay. So different countries have different rules. The egg or the embryo or the sperms are frozen in liquid nitrogen at a temperature of minus 196-degree temperature. Um, the policy of our country, of India, is to store the embryos, eggs, or sperms for a maximum duration of 10 years without compromising their quality.
Okay. So now let's hear a few factors that might increase the chances of a successful IVF procedure. What can
So,
increase the rate of success?
a healthy mind and a healthy body is essential for a pregnancy. So it's very important that we attempt to be in our best shape and size when we are planning an IVF cycle. It is very important to have a balanced diet, exercise every day, at least 30 minutes daily. Have a good night's sleep, keep yourself hydrated, and follow the instructions of the fertility specialist doing your transfer. Follow what all timings of the medication is given to you by your fertility specialist, because in a frozen embryo cycle or a fresh embryo cycle, it is very important to maintain the progesterone levels inside our body. After the embryo transfer, it is important to rest for 2 days, but prolonged bed rest is never advised, because if a woman is resting throughout after embryo transfer, then due to inactivity, the blood supply to the womb of the lady is low and can inhibit in the success rate of an IVF cycle. So, healthy mind, healthy body, following all the medications given by your fertility specialist, and spending an active life is important for IVF success.
Now, what factors, like you said, having a healthy mind, healthy body. I know if you don't have that, those are the factors that are going against a successful IVF treatment. But what other factors are there that might be an obstacle to a successful IVF treatment?
So, the success rate of an IVF cycle depends upon two things. One is the embryo quality, and the other is the uterine receptivity to an embryo. So, embryo quality depends upon the quality of egg and sperm, which in turns depend upon the which in turn depends upon the age of the commissioning couple, on their lifestyle, and also on the cause of infertility. So, embryo grading is very important factor in determining the success rate of an IVF cycle. The next parameter is the womb or the uterus of the mother. The womb should have optimal blood supply, which we diagnose by doing a Doppler study of the uterus. The lining or the bed of pregnancy should be a very beautiful triple layer lining, more than 7.5 millimeter in thickness. And obviously, the timing is important. We have to prepare the bed of pregnancy and then only transfer the embryos. Of course, stay away from any sort of addiction like smoking, alcohol, and maintain a healthy lifestyle. All these things will surely make the IVF cycle successful.
um, like you were saying that what factors might affect like the embryo's quality and the environment in which you're putting the embryo in. So how quickly can you determine that this is going to be a successful transplant or this is not going to be successful? How quickly can you realize it?
So, at least 9 days post transfer have to be given. And then we do a blood test called beta HCG. After 9 days, the beta HCG should be more than 50 to label it as a successful pregnancy.
No, I meant like, how can you say to the patients, like, yes, you might have uh, 50 or like 90% chance of a
Ah,
successful
okay,
IVF
okay,
treatment. Yeah.
okay. So again, IVF treatment success is very much dependent upon the quality and grading of embryos. If you are
Yes.
transferring excellent or very good quality embryos, if I have to label it, we are transferring 511 or 512 grade of embryos. And if the transfer procedure has been very, very smooth, the movement of the catheter inside the uterus has been really smooth, with no blood on the catheter, we are very, very confident and we come out and say to the couple that we are expecting almost 80% success in the procedure we've done.
Okay. So in the initial stages, you can let them know like how well it's going to be.
Yeah, so we obviously we cannot predict success, but at least we have the satisfaction on the day of transfer that we've done things properly, that the embryos were fine, the bed of the pregnancy or the lining of the uterus was fine, and the entire process went smoothly without any problem.
Okay. Now coming to another point, like which step of the IVF procedure is the most critical or the risk-bearing step?
Of course, when we are transferring the small little embryo inside the womb of the lady, that's the most critical step of an IVF cycle. If there is any problem in conducting this step smoothly, we are heading towards a failure. So it's very important that the embryos are the embryologist dealing with the embryos are best in his or her expertise. The clinician who's transferring these embryos inside the womb of the lady is very experienced to ensure a healthy pregnancy and a successful embryo transfer.
Um, So let's say if someone has very they did not conceive after one round of IVF. So how quickly or how often can they do another round?
So, doing an IVF cycle is not important. Important is to analyze what was the reason of failure of an IVF cycle. So, I will always suggest my viewers to analyze what was the reason of failure of an IVF cycle. So,
Hello? I think the screen froze a little. I couldn't hear you on the last answer. If you could please.
I I apologize. There was some network issue.
All right, that's all right.
So,
Yes.
yeah. So I always tell all the couples coming to me that please don't hurry to do the next IVF cycle. It is very important to first analyze what went wrong with the IVF cycle. Is there any step or any additional test that we can do to ensure success in this very cycle? If we talk clinically, the woman is ready for another IVF cycle after one natural period, that is approximately after 40 to 45 days of one failure. But before that, please visit the fertility specialist. Understand if we can pinpoint any cause of failure, like immunological cause, like karyotypic issues, whether PGA or ERA is required or not. Do such testing and only then proceed to a next IVF cycle.
Okay. So if IVF is done once, what does it reduce the chance of having a second baby?
Not at all. So there is myth in minds of many couples that IVF can reduce our ovarian reserve. It can reduce the number of eggs which we have inside the ovary. It can be dangerous to the health of the mother or the health of the child. But I want to highlight that there has been enough scientific data to prove this false. IVF does not reduce our ovarian reserve, does not harm the female body, and we can very easily conceive our next child. And it is not necessary that if one child is conceived through an IVF cycle, the next one will require an IVF. So, for
That was
sure,
going to be
this
my next question, but thank you for
can you please say that again? I'm sorry, I lost you.
No, no, I was going to ask you that question, but you answered it on your own.
Okay. So,
All right. So now coming to our next question. Yes, can you hear me? All right. Okay. Now coming to a more detailed understanding of IVF treatment in India. So why should someone choose to do IVF treatment in India?
so whenever anybody is deciding on to the IVF center, it is very important to understand what are the facilities available inside the IVF lab. So the heart of an IVF cycle is the embryology lab and the embryologist. We should have best in class equipments to perform an IVF. The maintenance of these instruments are very, very crucial. So, whenever you decide onto an IVF center, it is very important to understand their lab and also understand what best facilities do that IVF center offers. So, anybody who is planning to get an IVF cycle done here in India, I can vouch for the Indian conditions. The Indian doctors and the embryologists here, especially in Birla Fertility, are all following European and American standards to perform an IVF cycle. It is a very, very ethically done procedure. We ensure a success rate of more than 75%. And we have best in class laboratory, the best in class incubators. We do embryo biopsies in cases where it is required. All the facilities to perform ERA cycle or any advanced test are available here. So, in case you want to search a place for getting your IVF done, it is very important to be sure about the embryology lab. And it should be a very, very ethically done center.
Now, everyone who is having problems conceiving naturally, they will opt for IVF. But people around them try to surround them with various misconceptions and various risk factors that are associated with IVF. What are the common things that you hear as a doctor from your patients?
So, IVF is something which is never our first choice. And believe me, it is never advised at the first step. So, once we are sure that natural methods are not helping us, smaller techniques like IUI are not helping, only then any doctor would advise you an IVF cycle. But be rest assured, if you are advised an IVF cycle by your clinician, IVF is completely safe for you and your baby. So it's been more than 40 years that this process has been done. More than 8.5 million babies have been born out of this process. There has been enough research to prove that this is not harmful for the mother or for the health of the unborn child. IVF is completely natural process and it will not deplete your ovarian reserve or make your biological clock go ahead in a faster pace if you do an IVF cycle. So please be rest assured that this is a completely safe process to conceive a pregnancy and anybody can
Hello?
Yes, I can hear you.
All right. So I had one more question. What advice or suggestions you will give to couples who are planning to do an IVF treatment process? Go through this
So
journey.
my only and very important advice to everyone who is undergoing an IVF cycle is please do not fear the process. Think and research before opting or starting an IVF cycle. But once you've started it, please trust your doctor. Please trust the fertility center. Please rest yourself mentally. Let your body and mind be calm before you start the IVF cycle. That's the most important thing. And most of us are too much stressed during the process that we cannot mentally and physically surrender. So it's always important to prepare yourself right, do all the research that's possible, but that is important before we start. After you start, please be positive because even in bleakest possibility of very low ovarian reserve, 41, 42-year-old lady, we have seen success by your very own eggs. So please trust your doctor once you have finally decided that this is the right place to have your child.
So, doctor, let's just We're almost at the end. So if you could say a few more words about IVF and IVF treatment in India, and we can wrap this session up now.
So, I would want to highlight that more than 8.5 million kids have been born from IVF. IVF is a blessing. It's the biggest wonder that science has done to help us become parents. And with the present age science, none of us will be childless. If we want a child, there is a technique to help you to become a father or a mother. In India, we do ethical practice, follow all the guidelines, do our level best, and henceforth, we can very proudly say that we've achieved a success rate of more than 75% in the cycles we do IVF for. So, if you've been advised an IVF cycle, please do not delay. Go to your fertility specialist and start your treatment as soon as possible.
Thank you so much, Dr. Prachi. We had a very, very informative session today. We were very blessed and we're very grateful to have you here today. And the information that we have gotten from you, it's going to help various couples, multiple couples, to take their initial step towards an IVF treatment procedure. Thank you so much, Doctor. And I would like to thank the audience for staying with us and getting to know more about this treatment procedure. Thank you.
Thank you so much. It was a privilege being on your channel. Thank you so very
Oh,
much.
thank you so much.
Thank you.
Thank you.